Well, I mean, according to everybody around the country, he wouldn't be here in 2 years because he's going to die because the coronavirus is a death sentence.
What are you talking about?
Here we go.
Not to him, but to other people around him, it could be. Yeah. Right, Ben?
Yeah. So there are a lot of things.
Oh, my God. You're one of those.
I'm one of those.
This is Beaverville. Come on in.
I'm one of those. I'm one of those non-panickers. Go ahead and go buy out the store, Rosie.
There's a difference between panic. There's a difference between being panicked and being
aware is one thing, but causing panic is another.
What do you mean by causing panic?
Okay, so what is going on with this whole thing that is clogging up the system? Is that we're creating panic? People are freaking out because they get a cough, they feel a little down, and they go right to the ER.
No, they don't.
Yeah, people are.
Well, they are, but they can't get tested.
Exactly, but they're causing fear and panic, so everybody's going right to the hospital and saying, like, I got it. I got to go get tested. And then there's actual people that are sick that need help. Well, they're creating bottlenecks when we don't need to create bottlenecks in the healthcare system. And the people that really are sick with the coronavirus, that really are getting affected, have to wait hours and hours and hours. There's not even beds for people. There's not even, just calm down, people. 80% of you that get it, it's going to feel like a cold.
That's true, but the other 20% might be really, really serious.
Exactly. So
that's why people are dying all over the world.
So the other 20%, let's leave the hospitals and leave the waiting rooms and lobbies open for them to go and get help.
But I think basically people are being told by their doctor, stay home. If you have a cold or whatever, and you're not being allowed, you can go to the ER. They're not going to sit there and spend a lot of time. They're not going to admit you. You're not taking up a hospital bed because you have a common cold. They're going to send you home in a heartbeat. Absolutely, they're not spending the night in a hospital.
They're spending time. They're
doing what?
They're logging up the system, though.
Well, but to be fair, Ben, how do you know if you don't have coronavirus? How do you know if you don't get tested? How?
But if you have the symptoms,
right now we don't even have enough tests to go around. So
that's just what I'm saying.
So
you just made my point.
So we need to be logical and rational about this awareness and not freak people out and say, all right, if you're feeling a little blue and a little down, just stay home, self-quarantine yourself. Let's take precautions in that area. Let's not run out to the doctor's office when they can't even help you anyway.
But getting back to your point about Rudy Gobert is a healthy. There's also a man in his 30s who's in critical condition right now in our area,
Anoka County,
right? So I mean that from the coronavirus. So how do you know? I mean, he's a 30-year-old man. So if you're Rudy Gobert, it's not about Rudy Gobert's necessarily his health. It's about the people who he's around. Maybe a trader, maybe the guy who's 60, maybe he's got underlying health issues. He's affecting all those people. That's why they're shutting all this stuff down. You do understand that.
I do understand.
Well, then that's the only point that we're talking about here. And as far as the general public goes, if he's around the trainers, administrators, PR people, whatever it is, that's why they shut everything down last night, because it's not about Rudy Gobert. He's probably going to be fine. It's the people around him who may not be.
So why don't they do this with every illness then? Every potential illness that could harm somebody in a severe.
Give me another example, because they don't have a vaccine for this. You understand? There's no vaccine for this. There's nothing that can cure this right now.
They admitted this year's flu vaccine missed a lot of strains. So even if you're being precautious with a quote unquote vaccine, it still didn't help the people that got certain strains of the flu this year.
No, it didn't. You're right.
Exactly.
But I don't know.
So don't tell me that just getting a vaccine is going to cure it all, because
it may not.
It may not.
This is when you have a worldwide pandemic and people are dying all over the world and the numbers are escalating like crazy. What do you think you're supposed to do? Just ignore it and keep going into bigger. I mean, this is where we're at. This is where our country's at. This is why people are the health experts. I listen to the health experts, the people who go, this is this serious right now, and it's going to get a lot worse in this country. When you have what happened in Italy, what's going on in other places, this is where we're at. We're like 3 weeks behind the curve right now.
Look, Rose. I'm not saying that we shouldn't be taking precautions, right? Because it sounds like It sounds like
right. I'm not saying you should buy toilet paper. Believe me, I'm not on that other end.
Yeah,
either.
but your attitude though, and your tone of voice is like you're ready to jump on this panic as much as anybody else.
No, I'm not. I'm just being smart. I don't like the word panic. I'm not panicking at all. I want to go to Vegas in 2 weeks.
I think a lot of people are voicing a very heavy tone and creating false panic when we don't need to. That's all I'm saying. That's all. I
would rather err on the side of caution than look at this thing 2-3 weeks from now. Then you think they should be playing games right now, NCAA basketball games with crowds? You don't think anything should be canceled?
Yeah, I do think they should be playing.
Okay, all right. Well, I mean, maybe they should, but I just think that other people.
I think it's up to you as a person, personal responsibility. If you're that freaked out about it, then don't go outside.
Did you listen to the Joe Rogan podcast?
I did.
And the guy from the U of M did think that it was a good idea to stop gathering people in giant groups.
He did.
Yeah.
Correct.
Yeah.
This is what people
I took a lot of what he said to heart.
Mm-hmm.
I don't have to 100% agree with everything that he says.
There's a difference between being smart and being. You're saying panic. I'm not panicking about anything. I'm just listening to the experts. I'm not rushing to Costco and buying toilet paper and buying whatever I could buy on the shelves. I'm not doing any of that. My son's doing more of that in San Francisco, where the issue is much more severe right now, and on the West Coast, where they're telling everybody to stay home from work. So if you're being told by your boss to stay home from work, you're going, no big deal. I'll go to work today anyway. It's all good. Really? I find that really hard to believe. That you shouldn't be listening to the authorities.
If I'm getting a free day off, I'm going to take the free day off and work from home.
I'm not talking about free day off. I'm talking about
if my boss says stay home and do your work, well, fine, I'll stay home and do my work.
Because of the health concerns, not because of somebody like, for instance, CBS News shut down today in New York because 2 people got the coronavirus in New York. So they shut it down for 2 days because they want to scrub everything down, but. Based on your theory, you'd be like, well, you don't even have to do that. Just go to work today. Because it's just the coronavirus. You'll probably just get a cold. Right?
Yeah.
Okay. All right.
I love it!
Get it?
I think,
all right.
with all due respect, man. And I said with all due respect. So I say whatever I want.
Now you can say anything.
Now you can say whatever you want.
I think you are you're likely to react in a way that your circumstances dictate you can react. And for Rosie, he's in a situation where he doesn't want to be bringing home a disease. And for me, my son's in Seattle right now. I'm really worried about him.
Right.
Right now, I thank God for you. You're not in a spot where you're likely to bring anything home to anybody that's going to be affected by it. You know what I mean? And so I think your circumstances dictate your level of, and sorry to use the word, Rosie, but your level of panic. Your circumstances dictate your level of panic.
Yeah, I definitely don't think that I'm not looking at this selfishly. I absolutely have empathy for everybody that is around it and affected by it. I just think that we are at a point of hysteria versus a point of concern, and maybe that's semantics. But for me, there's a general feeling that. We didn't do all this stuff with other pandemics. And why all of a sudden that we are doing this now? Now, maybe we didn't react the proper way and we're trying to learn from our mistakes. That could be true too.
I have a slight answer for that though. Like MERS and SARS, I saw this last night on the news, were more deadly, but it was harder to transmit. This one moves really faster.
Yes.
So that's why I think we're overreacting. Like, to your point, we didn't shut down for swine flu or SARS or MERS
or the regular flu.
Right. But this one moves so easily that it's hard to stop unless we get proactive and try to stop it. Right? Flatten the curve. That's the phrase everybody says.
Let's
Let's not have a spike because then we're in trouble.